Hi everyone, how's everyone doing? Well, thank you for coming and thank you for having me. I'm really excited to be here, and I want to thank Jasmine for inviting me. She's been doing such a good job with organizing these lunch and learns, and I think they're great programs. So today I'm going to talk about the trends in medications for the disease states that we treat here. So Alzheimer's disease, Parkinson's, and multiple sclerosis. So I'm going to go through each disease state one by one, and then I'll talk about the medications that are being used and that have been around for a while, and then I'll move on to talking about the medications that are more recently approved and the advantages and the disadvantages of them, and kind of talk about the trend in where the drug development is going for the disease state. Then I'll also talk about any treatments that are in the pipeline and any promising new medications that are in clinical trials right now, and also talk about investigational drugs in general and what they are. So we'll start with multiple sclerosis. So multiple sclerosis, as many of you know, is a very disabling disease. It's very unpredictable. It's a disease of the central nervous system, which is your brain and the spinal cord. So what happens is the immune system attacks the nerve fibers, which causes communication problems in between your brain and the rest of your body. So your brain can't really communicate and control your body. And as the disease progresses, these nerve fibers get more and more damaged, and eventually they can become permanently damaged, causing permanent disability in patients. So there are several forms of multiple sclerosis. Most patients initially have relapsing remitting MS, which is a form that patients will go through a period of remission where they don't experience any symptoms. But then they'll have these isolated attacks where the symptoms arise, and then they'll go through a remission and attacks and the whole cycle. And another form of MS that patients have are progressive MS. So compared to the relapsing remitting MS, they don't have that long remission period. The symptoms are progressively getting worse. And in both of the forms of MS, eventually patients will move on to having a secondary progressive MS where the nerve fibers are permanently damaged and patients have permanent disability. So currently there's no known cure for MS, and the treatments that are available right now are targeted to improve function after an attack or to prevent these attacks, and those treatments are only approved for relapsing remitting MS. There's currently no effective treatment for progressive MS, unfortunately. So all of these medications I'll talk about are only approved for relapsing remitting MS. So these are some of the medications that are approved first. So interferons were approved first for MS. It was approved in the 90s. So there are 5 different forms of interferons. They just vary by how they're injected, the dosing schedule, just a little difference in side effects. And after the interferons, glutamate acetate was approved, which goes by the name of Copaxone. And recently, the generic version of Copaxone was approved, which makes this drug more available and cheaper for patients. So interferons and Copaxone are injectable drugs. So you have to inject yourself daily or at least a few times a week, which can be very inconvenient for patients. I mean, doing daily injections can be scary and also, at the same time, very inconvenient. So because of that, because of that, it's not as good as the newer drugs in MS, but it is still a really good drug because it's been around for a long time. So we know the drug very well. There have been a lot of studies and good data about its safety profile and how effective it is. But another downside of that, besides the frequent injections, is that the side effects of them can be quite bothersome. So all of MS drugs can have side effects, but for some reason, interferons and Copaxone have a more higher risk of experiencing side effects, such as injection site reactions, because you have to do daily injections, and then also flu-like symptoms, such as having a fever or a pain, body ache, headache. So these agents are usually used initially when the patient's first diagnosed, and then most patients eventually will need to move on to taking a more potent medication as the damage becomes more severe. So after the interferons and Copaxone, there were oral medications that were approved for MS. So you can kind of see in the trend of MS drugs, they're trying to make it more convenient for patients. So now we started with the injections, and now we have oral drugs. So fingolimide, which is Glynia, that's a brand name, was the first oral drug for MS, and then Aubagio and Tecfidera are also oral medications that are taken once daily or about 2 to 3 times a day. And mitoxantrone is actually a intravenous infusion that is given over fairly quickly, about 5 to 15 minutes. But it is not used as much anymore as the other drugs because of its toxicity profile. It's been shown to cause cardiotoxicity, so heart problems. And also recently there was a drug shortage of this drug, so it's just not used as much. The mitoxantrone, the first one. So yeah, so because of that, it's not used as much as the other drugs. So natalizumab goes by the name of Tysabri, that's a brand name, is the first IV, well, I guess it's not the first IV infusion. So mitoxantrone was the first IV infusion, but Tysabri is unique because it's a monthly IV infusion, so making it way more convenient for patients than doing daily injections or taking drug daily. And it's actually one of my favorite drugs because we do Tysabri infusions here at the clinic. And it is very effective. It's a lot more potent than the older agents that I talked about. And it's usually very well tolerated in patients. Patients don't have that much side effects from it. However, it does have a risk of developing a serious condition called progressive multifocal leukoencephalopathy, but we'll just call it PML because that's a mouthful of word. So this condition it's a viral infection of the central nervous system. So usually, I would say 50% of the population already are exposed to this virus, and they're typically benign. But because in MS patients, they're already immunocompromised, and the drugs that they're taking are immunosuppressing, so their immune system is very low. So because of that, when a patient is exposed or tests positive for this virus, it can lead to this condition, which is very serious and can sometimes be fatal. So because of this risk, Tysabri is available through this program monitored by the FDA called the REMS program, which stands for Risk Evaluation and Mitigation Strategy, for the FDA to monitor if patients are testing positive for this virus and follow up with the patients. And even though Tysabri is a really good drug, very effective, it is very expensive. One vial of Tysabri is about $5,000. And one vial is what you need for one infusion, but since this is a monthly infusion, if you times that by 12, that is $60,000, which can be very expensive. So usually it's saved for patients who have failed other treatments, such as interferons or Copaxone. So the most recent medication that was approved for MS is called Alemtuzumab, called Lemtrada, and we're actually in the progress of starting this medication here at our clinic. So it was approved in 2014, and it is also a IV infusion given over 4 hours. So Tysabri is given over 1 hour. This is given over 4 hours, but what's better about it than Tysabri is that it is an annual infusion, so patients only need to come in yearly. So the first course of the infusion is given for 5 consecutive days, and then a year later, patients come back and they're given an infusion for 3 consecutive days. So Lemtrada has a very potent efficacy, probably the most potent out of all the MS drugs that are approved. So it is very effective. It's usually safe for patients who failed other treatments previously. Also, it's convenient because it's an annual infusion. But because this drug is so potent, it does have some safety issues because if the drug is really potent, there's too much of the drug in your body can cause toxicity also. So the main safety concern is that patients can develop secondary autoimmunity. So it can cause thyroid disorders, it can cause cytopenias, which is a blood-related disorders, and also can put the patient at risk for malignancies. And because of these safety concerns, like Tysabri, you do need to enroll in the REMS program monitored by the FDA, but it is a little more complicated than Tysabri. So the prescriber, the patient, and the clinics that are infusing the medication also need to be registered and qualified by the FDA to give Lemtrada. And the patients need to comply with these monitoring tests that they have to do to detect any signs and symptoms of developing these conditions. And even though this is an annual infusion, those tests, you have to come in every month to do the test. So that kind of defeats the purpose of having an annual infusion, but I think that's still better than doing a monthly or daily injections. So because of that, it is very restricted. It's a very complicated process to get the medication. So those are all the medications for multiple sclerosis that are available. And now we'll move on to talking about Parkinson's disease. So Parkinson's disease is also a neurological disorder, mainly causing problems in the body's movement. So the main symptoms of Parkinson's are tremors, rigidity, can cause slowness of the movement, and postural instability. And like MS, there's no cure for Parkinson's, but there are treatments available to manage the symptoms. The cause of Parkinson's is unknown, but it's thought to be due to a depletion of a brain chemical called dopamine. So dopamine is needed for your brain to control your body, but in Parkinson's, this level is very low, and as the disease progresses, it can continue to decrease. So many of the treatments for Parkinson's are targeting this dopamine level to balance it and to increase its level. Does any of these medications look familiar to you? Yeah? So the first medication, Carbidopa Levodopa, brand name is Sinemet. It's probably the most popular medication for Parkinson's and what's probably used the most. but this medication does have some disadvantages of it. So first, it can cause side effects that can actually mirror the symptoms of Parkinson's. So it can cause side effects that also affects the body's movement and causing the patient to have involuntary, uncontrollable movement, similar to the symptoms of Parkinson's. So some of these other medications are used to control that side effect of Sinemet. So amantadine on the very bottom is used in conjunction with Sinemet to minimize those side effects of Sinemet. Another downside of Sinemet is, it's a great drug, but another downside of Sinemet is that the drug effect doesn't last in your body long enough to control the symptoms. So as you can see, there are two components, Carbidopa and Levodopa. And Levodopa is actually the drug that you want the effect. And Carbidopa is mainly there to help Levodopa be absorbed in your body. But the problem with Levodopa is that it doesn't stay in your body or have a consistent drug level, that many patients can experience these off times where the drug level gets really low in the body and the symptoms of Parkinson's come back until they take the next dose. So there are also other medications to help patients who are having these off periods, who are on Sinemet or other Parkinson's disease. So apomorphine, it's a injection medication that drug is actually used to help with the off periods of Sinemet. So patients can give injections up to, I believe, 5 times a day whenever they're having these off periods to temporarily relieve that symptom. Let's see. Benztropine, that's supposed to be a Z. So benztropine, also called Cogentin, and triaxiphenidol. Those two are mainly used for tremors related to Parkinson's.
Which one did you say?
The benztropine, that's the third one down. It's supposed to be a Z, not an X. That was a typo. I don't know where I was looking when I was typing. So benztropine and triaxiphenidol, those two are used for tremors mainly. And botulinum toxin, known as Botox. There are many different types of botulinum toxin, but Botox is that's what's mainly used, and we actually do Botox injections here at our clinic. So Botox injections are given to control certain symptoms of Parkinson's. So dystonia is any jerky, involuntary movement of certain part of your body. Also excessive drooling. So patients will get injections at specific sites, and those symptoms can be controlled up to 3 months at a time. So patients come back every 3 months to get injections, and it is very effective in controlling those symptoms. So talking about the most recently approved medications for Parkinson's. So Rytary was one of the new medications. It's not necessarily a new medication because it's the same components as Sinemet. So it also has Carbidopa and Levodopa. But like I mentioned earlier, the problem with Sinemet is that it doesn't last in your body long enough, causing patients to have these off times. So Rytary was approved in 2015 as a long-acting formulation of Sinemet. So Sinemet lasts about 1 to 1.5 hours in your body. This drug is supposedly lasts about 4 to 5 hours in your body. So as you will see in other new Parkinson's medications, the main goal is to increase this time that Sinemet stays in your body. So Rytary was approved for that, and it is it comes in a capsule formulation where they are, where there are little beads inside the capsule, and the beads inside, they're formulated so when you take the capsule gets dissolved, and the beads actually gets released at different times. So because of that, the effect of the drug lasts longer than just taking a pill of Sinemet. So similar to Rytary, this other drug that also has the same components as Sinemet was approved in 2015. It's called Duopa, and it is a gel formulation of Sinemet. So it's a suspension that is infused directly into the small intestine via a pump that is continuously infused for about up to 16 hours a day. And in order to have this pump, a tube needs to be surgically put in place inside to bypass the stomach so the drug doesn't get absorbed in the stomach, to bypass the stomach and directly into the small intestine. So patients have to wear this quite large box in their belt area, which can be very inconvenient. There are also other problems that can come with it. It can get infected. The site that the tube was put in can get infected. The pump, the box can move around. Also, you might need a help of other people to manage the box. So there are quite a few device-related problems. So this drug is safe for patients who have more advanced disease. And who need to control their symptoms more, and who are having too many off times on Sinemet, so they can have a more constant level of the drug in their body. So this drug was approved in 2014, droxidopa. It's not to manage the symptoms of Parkinson's, but rather it's to manage side effect of Parkinson's. So Parkinson's patients are at risk of developing a condition called orthostatic hypotension. So orthostatic hypotension is when you're sitting down or when you're lying down and you get up, your blood pressure gets too low all of a sudden, causing you to have a fall. So this drug is unique because it's for orthostatic hypotension, but it's only for orthostatic hypotension caused by neurological disorders. So those are all the medications that are currently available for Parkinson's. And lastly, let's talk about Alzheimer's disease. So Alzheimer's disease, I'm sure many of you know, it's the most common form of dementia, can cause many behavioral cognitive issues, and it's progressive, and patients usually, eventually they can't function independently. And unfortunately, there are not that many treatments available. So there are only 4 drugs available for Alzheimer's currently, and that's why we are so passionate about finding cure for Alzheimer's at our center. So these are the 4 drugs that are currently available. I think it's a very sad list compared to the other diseases. So these medications, they don't cure Alzheimer's disease, they're just to control the symptoms of Alzheimer's. So the first 3 medications are used in more mild patients, and memantine, the last drug, is safe for more moderate to severe patients. And in the last decade, there are about 400 clinical trials that were looking to find treatment for Alzheimer's. And among that, only 1 drug was approved, which is memantine, which was approved in 2003. So I think you can say that there was 99% failure rate in the last decade in finding cure for Alzheimer's, which There are 400 clinical trials and only one drug was approved, and it was only for symptomatic treatment. It wasn't curing the disease. So currently there are about 120 clinical trials that are ongoing for Alzheimer's. So hopefully we can find a cure in one of those treatments that are in the pipeline. So there was one drug that was recently approved for Alzheimer's in 2014. It's not a new drug. It's actually a combination of memantine, extended release, and donepezil. And just because it's not a new drug doesn't mean that it can be really helpful for patients. This can really help patients to control their symptoms better and have a more consistent drug in their body. So this is safe for patients with more moderate to severe Alzheimer's disease. It comes in an extended release capsule that is taken once daily. And a good thing about this is that you can open the capsule and sprinkle it on food. You can sprinkle it on applesauce, I don't know, yogurt. So those are some advantages of this drug. But still, it's not a, I'm sorry.
Can you explain what you're saying, that this is to control some of the symptoms of the disease? What
Yeah, of
symptoms
course.
are you referring to?
So Alzheimer's disease, patients usually have symptoms such as cognitive issues, memory issues. Patients can also have behavioral issues, inappropriate behaviors. So the medications that are listed here are to control those symptoms. For patients to have a better quality of life. It's not going to cure the treatment itself, but it might slow down the progression a little farther. Does that answer your question?
So it's really not going to help with their cognitive thinking?
Not necessarily. It might, so if used in a mild patient, it might kind of extend the time that they're going to progress into a more advanced disease. Does that answer the question? So that's why it's so important to find a better treatment for Alzheimer's, because these medications have been used for a long time and they do help patients in slowing down the disease by a little bit, but they're not very significant, and most patients will eventually move on to having a more advanced disease. And I'll talk about more medications that seem promising that are currently in clinical trials right now. So lastly, I wanted to talk about treatments that are currently emerging that are in phase 3 clinical trials. So in clinical trials, there are 3 main parts of clinical trials. There's phase 1, phase 2, phase 3. If a medication is in a phase 3, you can kind of assume that it has shown some sort of efficacy and it has a good safety profile. It takes a really long time for a drug to be in phase 3 and a lot of money and a lot of manpower. So I'll talk about some of the agents that are in phase 3 that seem promising for the disease states. So briefly, before we go on, I want to talk about what an investigational drug is. The name kind of gives off the definition. So it's a drug that is currently being investigated in a trial to be used in a certain disease. So it's can be a novel drug, so it can be a new molecule that it's not available for any diseases. Or it can be a already approved drug for different diseases. So for example, in Alzheimer's right now, we're studying insulin. So insulin is approved for diabetes. But since we're studying insulin for this new indication, this new disease, Alzheimer's disease, you still have to study it in clinical trials to see how the drug affects this different population of people with Alzheimer's disease. So, so all these drugs are called investigational drug. Any drug that is in a clinical trial is called an investigational drug. And you might see these investigational drugs have very weird names consisting of random letters and numbers. And usually when a drug is in the early phase of being developed, it's given its chemical name. And then after that, once the drug is in phase 2 and phase 3, they're given a generic name. And then once the drug gets approved, it's given a brand name by the pharmaceutical company that made the drug. Sometimes these brand names can be very interesting. I don't know how the companies come up with these names, but sometimes I can't even pronounce some of the names that I see out there. So for example, so Azilect is what Azilect is the brand name, and then before that it had a chemical name of TVP1012. So I just thought that was a little interesting. So starting with multiple, I'm sorry.
The Azilect, I take that now
Mm-hmm.
for my Parkinson'S.
Mm-hmm.
But on your sheet it's saying that it's an investigation. Just an example.
So the question was that Azilect was listed under an investigational drug. So I use this just as an example. Mm-hmm. So before Azilect was approved, it had the name of TVP1012, which I thought was interesting, yeah. And once it was approved, the company who made Azilect gave the name Azilect. So in multiple sclerosis, there are 2 medications that are currently in clinical trials that are very promising. So the first drug is said to be a game changer in MS, so it's called Ocrelizumab. Doesn't have a brand name yet because it's not approved, but it's currently in phase 3 clinical trials and it seems to be very effective. And what's unique is that it is effective in relapsing remitting MS, but also it has been shown to be effective in progressive MS. So as I mentioned earlier, there are currently no effective treatments for progressive MS, but if this drug gets approved, then it will be the first one to be used in progressive MS. Yes?
What are the known side effects of this drug?
So the question was, what are the known side effects of Ocrelizumab? So Ocrelizumab is still being studied right now, but in the previous studies, it's shown to have a similar side effect as other MS drugs. So most MS drugs have very similar side effects, which is infusion reactions. You can get nausea, flu-like symptoms.
So I've taken those, and I've taken Gilenya now, and there isn't any, I've been great on that.
So just because there are side effects doesn't mean that all patients are going to experience the side effect. But the side effects are listed for patients to be aware of them, that there is a possible chance of experiencing that, and also for your doctors and prescribers to watch out for those symptoms. So if the symptoms get too severe, we can switch you to a different drug or prescribe you something else to manage those side effects.
But there aren't any known horrible side effects yet on this.
So since this drug is still in clinical trials right now, the safety profile of it is still being studied, the side effects of it, but I think it's probably going to be similar to the other multiple sclerosis medications.
So this is stage 1 trial?
So this is in
For
phase
clinical.
3,
Oh, it is?
phase 3 clinical trial. So all of the medications that I'm going to be talking about from now are mainly in phase 3. So if a drug is in phase 3, like I said, it's likely going to be effective for the disease. But of course, it does have to meet the primary objectives of the studies in order for it to be approved by the FDA. Another medication that are being studied for MS is Daclizumab. It's being studied for relapsing forms of MS, and those two medications are both IV infusions that are given. So for Parkinson's disease, fortunately, there aren't that many medications that are in phase 3 clinical trials. But there's this one medication that I thought was interesting. It's an accordion pill of levodopa and carbidopa, the same components as Sinemet. But this one is thought to have an 8-hour of drug release in your body, so preventing patients to have those off times. So if you remember, Rytary, one of the new medications approved for Parkinson's that had 4 to 5 hours of drug release, but this one is thought to have 8 hours of release. There are also treatments being studied to slow down the progression of Parkinson's and reverse the disease, but this is very hard because we don't know the cause of Parkinson's, and if we don't know what is causing the disease, it's very hard to find what can cure it. This last drug, I'm not even going to try to pronounce that, so I'll just refer to it as KW6002. So I just wanted to mention this drug because this drug was being studied to be used in conjunction with Sinemet, to help Sinemet to be more effective. But when the drug company filed to start a clinical trial with this drug, the FDA actually denied it because this drug, they're saying that it wasn't as effective as the treatments that are already available. So in order for a drug to be effective, it needs to show in clinical trials that it is more effective than a placebo, so patients who are taking sugar pills. It obviously needs to be more effective than that, and also is it as effective or more effective than the treatments that are already available. So this drug was denied to be in clinical trials in the US, but in Japan, it was recently approved because they conducted a study with this drug in a Japanese population, and actually it was actually shown to be very effective in those patients. So I just thought it was interesting to see how a drug can cause different efficacy in different populations. So maybe in Japanese population, the drug was more effective, but not in the U.S. population. Yes?
When the drug is proven to be more effective, say similar effective, is the cost ever taken into account, or the potential cost? Say if something was similar, but it cost far less, that would be more advantageous, wouldn't it?
Right, so the question was that if a drug cost is a factor in a drug being approved by the FDA. So that definitely is a big factor, but I would say it's more of a concern when the drug already has been approved and when the doctor is trying to prescribe that drug to patients, because medications that have been around for a long time are I would say fairly cheap, because when a drug first gets approved, the drug company who developed that drug has the right to sell that drug for many years. So no other company can make that drug, sell that drug, which makes, which gives the power to the company to charge however much they want. So as you saw in the MS medication, so Tysabri, like I mentioned, is $5,000 per vial. It's because the drug company can do that, which is not very nice, but they can. So I would say, so for example, in Alzheimer's disease, there aren't new drugs available, and there are all these companies studying new treatments. And there is this one drug called Leukoencephalopathy, which I'll talk about right now. So it's a drug being studied for Alzheimer's disease, and it is in phase 3 clinical trials right now. And in order for a drug to get to phase 3, it takes a lot of money, millions and billions of dollars. And Leukoencephalopathy was in a phase 3 clinical trial being studied in Alzheimer's patients with a more advanced disease. And it actually did not show efficacy in these patients. It did not meet its primary objective. But if you think about it, the companies have already put in so much money and effort into this disease, not the disease, the medication, that once the drug gets into phase 3, it's really hard for companies to back down and let go of the drug because they've invested so much. And if the drug gets approved, it'll be the only drug available for Alzheimer's disease, which means that they can charge whatever amount that they want. So to answer your question, during the clinical trial, the cost is not a big factor in getting the drug approved, but there are some companies out there who are only targeting diseases that have very few treatments, because if they do get the drug approved, it's a lot of money for them because they can charge how much ever they want. So it's a sad reality, but it is how it is. So for Alzheimer's disease, there are, like I said, there are about 120 clinical trials going on, and these are some medications that are promising. And I forgot to mention, so medications with the apostrophe at the end are medications that we are using for clinical trials here at the center. So let me just go back. So Parkinson's, we're not doing any studies with Parkinson's yet. For MS, we're currently doing a study with Leukoencephalopathy.
And that's an IV?
Yeah, so that's an IV infusion.
How often?
So the dose is still being studied, but it is given, in this clinical trial, patients are getting it one course, one infusion, and then 14 days after they get another infusion, and then about 6 months later they get another infusion. So it's definitely better than giving daily injections or having to take an oral medication every day. So for Alzheimer's disease, Alzheimer's disease is probably the disease that we have the most clinical trials here at the center. So Alemtuzumab is a drug that we are, it's not currently ongoing, but we're about to start. So it's a IV monthly infusion. Also, the drug below it, AVP 786, it's being studied to control behavioral symptoms of Alzheimer's, so symptoms such as inappropriate behaviors. It is being studied to treat that. Leukoencephalopathy, I mentioned earlier, it's also a IV infusion that is given monthly.
What inappropriate behavior are you?
So appropriate behavior such as, that is, I would say that's very prominent. So to give an example, just, I don't know, just going on a subway and taking all your clothes off, or, like something very inappropriate that a person with a normal cognition would not do. Does that answer your question?
Inhibition.
Yes, yes. And this study is actually called disinhibition study. Another drug, it's TRX0237, so that's a chemical name of the drug. I thought this drug was unique because it's actually targeting a different mechanism in the brain than other medications that are being studied. Below that is a drug that is combining an IV infusion and an oral medication. I believe we're starting that trial soon. And we're also studying rasagiline, which is being used in Parkinson's, and now we're studying it to see if it is effective in Alzheimer's disease. So that completes my talk, and really want to thank you guys for staying and listening to me and for having me. So now I'll take any questions that you might have. Yes.
The one with that Duopa, that gel formula that was infused,
Okay.
why was that only going for 16 hours a day?
So the question was why Duopa is being infused for only 16 hours a day. To be honest, I'm not exactly sure. I think it is to give...
I mean, you wouldn't have any constant level during sleep then?
So 16 hours a day. So the drug itself, when it's being continuously infused, it doesn't mean that it's not going to have an effect when the infusion is being stopped. It would still continue to have an effect in your body.
Right, but you said that the duration of action is normally, for some of the other ones, 1 to 5 hours and 4 to 5 hours, so that would not even be in the window.
So that is a great question, but I don't know the exact answer to that, but my guess would be that maybe to give a break to the body. I mean, to have a drug continuously being infused every single day, it can be burdensome for your body to handle that medication. So I think maybe it is to give a break, and I think 16 hours compared to what we currently have with generic form of Sinemet is definitely an improvement.
Like an insulin pump, that's more of a 24-hour.
Right, yeah. So insulin is different because the insulin level does have to be very constant. And my guess is that because 16 hours, it's because the drug can still have an effect even for the time that it's not being infused.
Or else that's because they are seeing what's happening in the 8 hours in between, and that's part of the study?
So this drug is already approved. So it's not being studied, but even though a drug is already approved, doesn't mean that it's not being studied anymore. We still want to follow the drug and see what the long-term side effects are and how it affects the patients in long term. So a lot of the medications enroll in a post-marketing study called phase 4 study. So I'm sure Duopa is still being studied in clinical trials post-marketing. But yeah, to answer your question, I'm not exactly sure, but my guess is that it's to give your body a break and because the drug can still have an effect after the 16 hours. Did you have a question, sir?
This is Patty in Hawthorne. I have a question.
Hi, Patty. How are you? Hello?
I was wondering, how does a patient get in on a clinical trial at their interest center?
So if you are interested in, are you interested in some of the drugs that I mentioned in the last few slides?
I don't know what drugs I'm interested in. I'm just wondering if
Just in general?
a person has Alzheimer's,
Mm-hmm.
and wants to get in on it, and they're not doing too much for it,
Mm-hmm.
and they would like to get in on a clinical trial. How do they go about doing that?
So a great way to do that, can you hear me? Hello?
Yes, I can hear you.
Okay, so a great way to do that.
I can hear you.
So a great way to do that is to go on a website called clinicaltrials.gov, clinicaltrials.gov. It is a government-funded website that has all of the clinical trials information that are currently ongoing. So anyone can access it. When you go on, you can type in Alzheimer's disease in the search bar, and all of the trials that are currently ongoing will pop up. And you can see what trials are currently recruiting patients and what trials have stopped recruiting patients. And when you click on that trial, and if you go to the very bottom of it, you'll see what locations are conducting that trial. And it should also have a contact information for you to contact if you are interested. Does that help?
Thank you. Can you give that website once more?
Yeah, of course. It's
Clinicaltrials.gov.
clinicaltrials.gov, G-O-V as Victor.
Thank you.
No problem. Any other questions? Yes.
I was just going to say in relation to the pump,
Mm-hmm.
okay, it doesn't say that it only works for 16 hours. It says that
You're right.
But also the fact that it's also,
It could be the sleep time.
yeah, but, okay, that's possible. Also, the fact that I would assume since they're pumping it constantly, they're using a much lower dose. The body is constantly being exposed to it. So
Yeah.
it also tend to be an accumulation.
Right. Yeah. So my guess was also that it's being continuously infused, but just because it's stopping doesn't mean that it's not having an effect. Yes.
Have they ever tried that topically?
I'm sorry?
Has anybody ever studied topically?
No, actually, no. I heard they're studying an intranasal, a nasal spray of Cinemet, but topically, I haven't heard of anything. Did you have
What about those patch drugs? Aren't those topical?
Patch drugs for Parkinson's, yeah, so I was referring to Cinemet. So Cinemet, Carbidopa, and Levodopa is actually not available as a patch form, but other medications in Parkinson's are available as patch forms.
I have a baclofen for MS because my fluid stopped.
Mhm.
You know, the oral, take the oral as much as I could. And they can put it on to work for 24 hours, a
Mhm.
little bit, but different times of the day, they can schedule it differently.
Right.
So when I'm sleeping or when I'm up or doing
Mhm.
things,
Mhm.
it can just automatically go to my
Right.
brain.
Yeah, so usually a pump you can adjust the rate of the drug going into your body and how much of it's going in to personalize it to your lifestyle.
So that's what they do because it's like it's a little computer that they
Mhm.
can shut. And they can do it exactly, you know, if you want it at 7 o'clock at night or in the morning or however. And they just do it and it's just
Yeah.
done. You don't notice any difference.
Yeah, great. Yeah, so that is one of the advantages of having a pump, I would say. Yes.
Getting back to this pump, you said it was fairly large,
Mm-hmm.
so if somebody were to try to sleep with it, it might be
Mhm.
very difficult.
Right. Yeah.
So that might be another reason they're only doing it for 16 hours so the patient can sleep also.
So the patient needs, I believe the patient needs to continuously wear it. They might.
And even if it's off,
So they might, so as you can see, so there are two parts of it. So the tube is connected directly to your small intestine. So you might be able to disconnect the programmer, but at the same time, at the same time, I think you might still have to wear the other part of it, which still can be really uncomfortable. So that is a big downside of it, is that you'll have to wear this all day. You can move around. you are going to need someone's help to program it, adjust it, disinfect the area. Any more questions? Yes.
So it looks to me like trying to get this drug, this Lemtrada and Levodopa.
Mm-hmm.
You try to get it into the ileum. Is that where we're trying to have it absorbed?
Yeah, so
We use it all times to time relief, things that will get it through the stomach into that area.
yeah, so we're trying to bypass the stomach because the drug, when a drug gets absorbed, when you take a drug orally, it goes into your stomach, and the stomach can actually metabolize the medication in a way that we don't want it to.
Right.
And
Destroy it.
yeah, and simply saying it can, I guess, we don't see the full effect of the medication because it gets metabolized in the stomach. So in order to bypass that, the tube is injected to bypass the stomach and directly into the small intestine.
And this other substance, you have different thicknesses of the time delay substance on the drug.
Right, so I think you're talking about...
Release at different times once it bypasses.
Mm-hmm. Right, so I think you're talking about Rytary. So it has these little beads that are coated differently,
Right.
that you digested, and it gets, each beads get released at different times.
Right.
So you
And
don't
the
get
other
a
problem-
sudden level of the drug in your body.
Some of these capsules, some of these particles could go too far downstream and then not be absorbed at all. Also, right?
No, so when the drug is ingested, it does get metabolized and dissolved in the stomach. It's just the matter of how it gets to the rest of your body. So when you ingest it, all of it gets, I would say, digested and metabolized, but it's just how your body absorbs it and how it travels through your body.
Thank you.
No problem.
If we could all get back to their round.
Thank you so much for having me. It was a pleasure being here, and I hope to see you all again. Have a great day.